Hi, this is Dr. Derek, and today we're going to be talking about back pain. Now, this is what chiropractors are known to treat, back pain. And people have this misconception that we're back doctors and that's all we treat. But it's such a common condition. So many Americans have back pain and it's debilitating. When you have the back pain, it's like right in the middle of your body. You can't do much. You can't do anything with your lower body and upper body, and it just knocks you out. You know, I see this in my office every single day. So I want to give you some tips today on what you can do to prevent it in the first place, and then if you do have a bout of back pain, maybe some things that you can do to get rid of it. So let's talk about what are the causes of back pain. Well, like I mentioned before, a big part is stress, and then when you're stressed, these vertebrae are going to be misaligned. You're going to have subluxations, hard bone, putting pressure on a soft nerve. That's just going to cause pain. And the problem could be here, and it could radiate down the leg, causing sciatica, could be in the glute, could be up in here, anywhere. So it's just good to get regular chiropractic care. You should be under regular chiropractic care with your doctor adjusting you regularly. But let's say you're still going regularly to your chiropractor, but you still have a bout of back pain. What may be causing it is adhesive scar tissue in the surrounding muscles. Now, there's a number of different muscles to work with in the back, and typically when people have back pain, they'll just massage right where the muscles are. And that's typically not the area that you want to work. The areas that I've found that have been most successful in fixing back pain are three primary muscles here. The first one is the gluteus maximus. The second is your psoas muscle here in the front, and the third is going to be your vastus lateralis, rectus femoris, upper thigh. Typically, if you clear those areas, it can do wonders for back pain. Those are the most common muscles. So I want to give you some, let's say, some things that you can do with the tennis ball that will be helpful in clearing that. So first is you can just lay on this tennis ball over here in the glutes. You know, you can just, you're laying on your back. It's hard to demonstrate here, but you're going to lay against the wall or your back and let it push in here and move all through this area here in the glute. If you put your hand over here over your glute, it kind of dips in there. That's the area where you want it to dig in. The second area is going to be the psoas. Now the psoas goes really deep. It attaches here on the femur and onto the lumbar vertebra. So it's almost impossible to use a tennis ball with the psoas up in here, but if you go below this area here where it attaches closer to the femur, you can get the insertion of that area by letting it dig in here, lying on your stomach and letting it dig here. And then lastly, the upper thigh here, the vastus lateralis and rectus femoris, if you let that dig, if you just move it a little bit further down from the psoas and clear this, that'll be helpful. Now, with that too, I want to give you three key stretches. You guys are really scoring here on these bonuses here. I'm going to give you three stretches that are awesome to help with low back pain. The first is the glute stretch. You're going to be like this, and you're just going to lean forward like this, and you should feel it stretching down the glute. If you had a tendency to low back pain, these are stretches you should be doing every single day. So there's the first one like this. The next one with the psoas stretch is great. You can just be on the floor, and you're going to be like this, and you're just going to lean forward. This is a great stretch for the psoas, and that'll kind of get this upper quad. But if you want to go a little more, you can just do this stretch in here like this. So there's other variations that you can do, but for simplicity's sake, these are things you can do at the office or at home, or if you're someplace, these are stretches you can do without much equipment, and it's very simple and easy to do. So we get great success with low back pain because using the Taylor method, we can identify exactly which muscles are causing the problem. And then one of the things that I've seen phenomenal for low back pain is the energy pressure wave technology, because it just goes in there like unlike anything else to break up the adhesive scar tissue. So we use this baby to go in, and it breaks up the scar tissue in these different areas. And you combine that with the stretch, and the results can be pretty profound. Like I mentioned before, the deeper you go, sometimes you may run into some soreness for the next couple of days, but it does great for getting rid of it altogether. So the other thing that you want to watch doing is try not sitting for long periods of time. Because when you sit for long periods of time, that psoas muscle is going to shorten, and then you're going to get up and it's going to be tight and it's going to pull on that back. So if you have a job where you're doing something where you're sitting, try not to sit more than 20 minutes, stand up, do that stretch, and that would be really helpful into reducing your chances of having low back pain. So I hope these tips have been helpful, hope these exercises have been helpful. Do them every day, and I think that you'll find that you'll have less back pain, and if you do have back pain, this may even help get you out of a pinch. I hope this has been helpful. This is Dr. Derek signing off.
Hi, my name is Pua, and I came in today in tears because I was in so much pain. I had not slept all night. My back was in a very bad spasm. I couldn't bend down to put my clothes on. I was desperate, and I heard of Dr. Taylor through my husband, who has seen him in the past. And they squeezed me in, and I'm so grateful. I'm leaving here a new person. I have had an amazing treatment, the hydrotherapy, and this new magic machine that is wonderful. It's broken up the spasms, and I can move. I can put my pants on a lot better. I'm doing much better. I'm so grateful, and I will look forward to my next treatment. Thank you so very much.